26 new community cases today here in Victoria, making a total of 133 positive cases of COVID as part of this community outbreak. We're now on day 11. 4 of those community cases are currently in hospital, and there is one CQV international arrival who's also in hospital. And of course, we wish all those in hospital all the best with their recovery and ongoing care. Just over 19,000 primary close contacts across the community outbreak. On the back of 43,604 tests. I'm pleased to report that just over 90% of those tests came back within 24 hours, and just under 98% of them came back within the day. And my thanks again to the pathology teams for the work they're doing to keep those numbers so high. And my thanks to everybody who's part of that testing program to keep us sighted on where the virus is moving in our community. I'll run through the new cases today with a bit of detail and then go through to the different exposure sites we've been talking about. So of the 26 new community cases today, 7 are linked to Trinity Grammar. That includes 2 staff members, 1 student and 4 onward household contacts. We have 6 of the new cases today associated with Miss Frankie's. That's 1 staff member, 3 patrons who visited on the 13th, 1 customer who visited on the 15th, and 1 onward household contact. That's a total of 13 cases. We have 2 cases linked to the Phillip Island outbreak. You remember a group of friends who travelled around the island. One of them is the final member of that group, so all members of that group are now COVID positive, and 1 onward household contact. That takes us to 15. We have 5 cases linked to St Patrick's in Marambina. 4 of those are students. Interestingly, those 4 students had tested negative earlier in the outbreak, have now turned positive during their isolation period, and 1 household contact. That takes us to 20. We have a household contact linked to an MCG case, it's 21, and 2 household contacts of the index case in Mildura, the individual who came to the football 10 days ago. That's 23 in total. We have 2 household contacts from the City of Hume cluster, so existing household members that we've known about, and finally 1 case linked to Amy Park. And I'll just spend a bit of a time on the last case. That's 26 in total. The Amy Park case is interesting. It was originally somebody who sat on the same side of the ground that we've known about, but well outside of that Tier 1 area. They were a Tier 2 contact initially. They came forward and got tested as part of their Tier 2 definition. When we revised our Tier 1 definition a few days ago on the grounds of evidence of some mingling outside of the ground, this case was incorporated and became a Tier 1 contact. He went back into isolation, tested again, and is positive. And as such, we have 1 day out in the community, which relates to the Prahran market exposure in particular. It highlights again, we've reviewed the CCTV footage again, we've seen this case mingling. We know again it's another case of transmission into queues outside the ground, getting in this case to gate 7. You recall a few days ago we talked about a case who was coming in through gate 6. So again, we're seeing this evidence of transmission in those unstructured crowds outside of major events. That's why it's so important for us to have expanded that Tier 1 definition, and of course the sheer number of primary close contacts we see in front of us today. I'll run through the major exposure sites and then just wrap up and we'll go to questions. So for the MCG, we now have 14 cases in total associated with the MCG event on the game on the 10th. 3,540 primary close contacts, 74% of them have now been returned a negative test result. At Miss Frankie's, we have 2 exposure dates, the 13th and the 15th. We now have a total of 31 cases associated with the restaurant. That includes 22 customers and 10 staff, and then other onward household contacts. 1,364 primary close contacts associated with the restaurant. 74% of them have returned a negative test result. And can I just say again, and for all of our exposure sites, and particularly Miss Frankie's, who work so incredibly hard to run a COVID-safe event, really fantastic QR code data and fantastic operation in a very challenging 10 days for the restaurant. So my thanks to them, their management and all their staff, and of course we wish them an ongoing positive recovery. At Amy Park on the 13th, 6 cases now associated with Amy Park, 2,648 primary close contacts. 67% of them have returned a negative test. Again, with a positive Amy Park case we see today, I'd really urge those remaining 30% or 33% of patrons who are there, I really want you to return a negative test. You're going through your isolation. I'm really keen to see what those test results are going to be. Trinity Grammar, 20 cases in total, 2,725 primary close contacts, 78% of them have returned a negative result. St Patrick's, 9 cases now in total, a few added on today, 411 primary close contacts, but 88% of all those PCCs have returned a negative test result. Then for Phillip Island, 805 primary close contacts, 60% of those a negative test result. The Coolaroo community outbreak, 14 cases now in total across 5 different households, 450 primary close contacts, 2/3 of them have returned a negative test result. And then finally, Mildura, the community outbreak there. Again, a fantastic effort by the Mildura community. Over 3,000 tests undertaken in the last few days. We've identified now a total of 4 positive cases, so the original index case and 3 of their household members. Obviously, we continue to support the wider community as we complete that testing programme over the next few days. Pleasingly, at the Ariel apartment complex, we've seen no new positive cases associated with that in the last 7 days. And at Bacchus Marsh Grammar, again, no new cases over the last couple of days. So good to see those holding stable. In terms of vaccination, 16 of our positive cases have been partially vaccinated and 5 have been fully vaccinated. And what's really good to see is that all of those who've been vaccinated, either partially or fully, they're either asymptomatic or they've got very mild symptoms. So again, it's a critical part, not only about reducing onward transmission, but particularly about looking after people's health. What today's results show, what the results of the last few days show, is 2 things. One is that I think, as Ben has said, we've got a very large net around this outbreak. We have a large number of PCCs, and that isolation is so important. It is not just in the first few days that people are testing positive. We have people who are in those 18,000, 19,000 PCCs who are testing positive a second time around after a week or after 8 or 9 days. So that sustain that isolation is critically important for the full length of your isolation period. And you will be released by the Department of Health. Please do not release yourself on the grounds that you think you feel okay. We have to sustain that isolation. That is how we'll stay and get on top of this remainders of this outbreak. We are now starting our day 13 testing, so side of how time is moving on. Day 13 testing is now starting for Ariel Apartments. We'll, of course, be going through the MCG wave over the weekend in terms of getting their day 13 tests. So again, as you come close to your day 13 test, you'll be reminded by us, but please come forward and get those tests done, so we can then get you negative test result and get you released from your isolation period. And finally, my thanks to the many carers and support people working behind the scenes to support, particularly the people who are in isolation, the people in hospital, and who are just caring for others in the community. This is a really challenging time for so many of us, and particularly for people who are going through the hard yards of isolation. If you are providing support to people in isolation, please do so in a COVID-safe way. Please be very, very careful. We cannot afford any further spread of this virus into other parts of the community. So please, if you're providing support, that's fantastic. If you need assistance about how to do that safely, please speak to us and we'll ensure that it gets to the right people.